This is the Grow Your Clinic podcast from Clinic Mastery. We help progressive health professionals to lead inspired teams, transform client experiences, and build clinics for good. Now, it's time to grow your clinic.
Welcome back to another episode of the Grow Your Clinic podcast. My name is Jack O'Brien. I'm your host today. And we have not just guests, but we have co-hosts with us. I have Michael Rizk and Peter Flynn from iMoveU. Mick, welcome to the podcast. How are you?
I'm good. Thank you, Jack. I was just thinking, what a time to be alive.
What a time.
Thank you for having me.
Pete, how are you, mate?
I'm going really well, thanks, mate. Thank you for having me too.
Oh, look, thank you for having me. I know this will be on the iMoveU podcast as well. So before we dive into an icebreaker round, and today we're going to dive into some clinic excellence indicators, topic around PVA. Before we do that, for those who are listening across different podcasts, if you're looking for the show notes and the links for the Grow Your Clinic podcast, perhaps this is your first time listening, you can head over to clinicmastery.com/podcast or search in your podcast player for Grow Your Clinic. And Pete, if people are looking for the iMoveU podcast, maybe, or for their younger practitioners and they want to share some of the iMoveU podcasts, how can they find you guys?
The easiest way is to check out our Facebook group or our website at imoveu.com.au. It has all the links on there, my friends.
Super stuff. Thank you. So we're going to dive into the topic of PVA, quite controversial, and then also episode visit averages and what numbers you should or could be looking at in your clinic. Before we do that, I'm going to go around the room for all of us and for listeners to get a bit of an insight. We've got a couple of icebreaker questions to get to know you boys, who are the founders of iMoveU and also part of the Clinic Mastery team. So are you ready for some icebreakers?
Yeah.
Fire away.
Let's do it. What are you reading right now?
I'm finally reading The Infinite Game by Simon Sinek. It's one of those ones that I've quoted a lot, and then I thought I better get the book if I quote it. So I'm about one chapter in, and it's good.
It's real good. Love it, Pete.
The Monk Who Sold His Ferrari. I've read it before, but I thought I'd read it again, and it is even better the second time round.
Who's the author?
Robin Sharma.
What's he most well known for?
Greatness Guide.
Greatness Guide. Oh, my, I'm so sorry.
You can take that one up with Shane Davis.
Yeah.
The Monk Who Sold. For me, I'm reading two. I'm reading Stillness is the Key by Ryan Holiday, who's a Stoic legend, and I'm listening to Mel Robbins' latest book, Take Control of Your Life. She's actually going to live life coaches people, and Mel Robbins is an absolute weapon. I love her stuff. She is a queen. Cool. Number two, who inspires you?
Well, for me, it's always Gary Vee, because I love his story, and I know what I'm seeing is a bit of a Gary Vee backlash, a Gary Vacklash, I was about to say, which makes me sad because I think a lot of people that have seen his work in the last 1 or 2 years don't really know where he's come from and his full story. And I think if you go right back to where he's come from and the very humble beginnings, he still inspires me. But I'm going to add a second one in there who inspires me recently. I was actually thinking of Jade Scott, who's Growth RX, and the way she's conducting that group is really exciting to me, and the way she's generating some discussion.
Awesome, mate. Pete?
I'm actually going to go someone who's quite close to me, and Shane Davis from Profit Podiatry. He's been my business mentor for a long time now, and he's now working with some of our team members, and just seeing how he conducts it, how he's able to bring out the best in people, it truly inspires me. If you've read the book Multipliers, I feel like it was written about him.
Yeah, 100%. So good. And for
yourself?
me, yeah, it's my family, my wife and my wife on one side, just seeing how hard she works for our family, and my kids really inspire me to be the best dad, but also the best business owner possible. And I really want to leave a legacy that lasts beyond just my time here on earth. And then, Gary Vee's a big one for me, and Dave Connett has been a personal mentor of mine for a long time. So, in a number of fronts. Okay, number three, what did you want to be growing up? Pete Flynn, quite timely. What did you want to be?
Well, I still haven't really grown up, if you ask anyone close to me. What did I want to be? I wanted to be a pilot, and then I found out I was colorblind and I couldn't do that. So then I decided that I wanted to join the army. You can't even do that if you're colorblind, so I eventually stopped on physio. Classic Stitcher.
Mick?
I don't know if I had a vision when I was young, but I love if I could play video games professionally for fun, not competitively like an esports person, but professionally for fun. That would be a thing I would do.
Oh, that's funny. I actually wanted to be a lawyer. I read a bunch of John Grisham books at like 10 or 12 years old, which I don't know how I got my hands on them, but really wanted to be a lawyer, Aaron Brockovich kind of style, and then a professional rugby league player, but injuries pulled me up there. And talent. Probably talent was the major limiting factor. And finally, what's a motto that you live by?
Be the person who gives the most value. Mick?
I don't know if I have something front of mind right now. I answered these questions for Ben Lynch the other day. It was in relation to what inspires me about Gary Vee. The original thing is that anyone can change the world. I really believe that, particularly with the technology we have. So I'll live by that one.
Nice. So we're going to tackle the topic of PVA, and this came up in a discussion in the background where, we as Clinic Mastery Business Academy mentors and clinic owners ourselves were tossing up the idea of how does PVA work and how do we calculate it? How do we reconcile it? So, Pete, I might throw to you. What on earth does PVA stand for? What does it mean?
PVA is your patient visit average. And it's essentially how many times that someone comes to see you for a certain issue that they have. And actually, that's where the discussion is going to come, because that's what I believe PVA to be. And we'll talk about this as episode value as well, is that if someone comes to see you for their back for 6 visits, and then they come and see you for their knee for 6 visits, to me, your PVA is 6 and not a PVA of 12. But I know we slightly differ on this, and that's really interesting, Jack. So maybe if you could give us your side of how you perceive PVA.
Well, I just think they're different numbers in the sense that a patient visit average for me is how many appointments or how many visits that patient will have across their lifetime. And that might be for, say 6 visits for a shoulder injury and 10 visits for a back injury. And so that patient visit average is 16. And so I just think they're different numbers, and neither is right nor wrong. They're just different. So, Mick, what do you measure in your clinic?
Well, this come from a mistake, which is actually amazing, and we learn from our mistakes. But 2 years later, I looked at my dashboard and realized we were actually measuring PVA, as Jack just explained it, which was how many times the patient had come back total, not per episode. So when I thought my practitioners were seeing someone, say, on average 14 times for an episode of back pain, that was not the case. It was actually that person had come 14 times to the clinic over their lifetime of care. So and that led to the discussion around semantics and getting our definitions correct. And since that discussion, what you just said resonates with me, Jack. The patient visit average is how many times they've come over a lifetime. The EVA, the episode visit average, is how many times they've come for that injury. I think it's more relevant to have the episode visit average for a young practitioner when they're starting out, because I want to know that they're getting over that just pain mentality and they're actually making our patients stronger and more robust. As the practitioner gets more experienced, I want to know that person is coming back for another episode of care, which would be the patient visit average.
It's interesting because I think these numbers, I'm thinking about, younger practitioners and those who have come through on our team. Numbers can be bewildering at the best of times, let alone when they lack context. So although it is just semantics, I think it's critical. And Pete, if I can throw to you, can you maybe explain the difference in your clinic from maybe yourself or the most senior experienced practitioner's PVA versus a new grad's PVA in their first year? they're going to be markedly different, right?
Yeah, absolutely. It'll be incredibly different because you'll have seen people maybe 4 or 5 times for different injuries. So you might have, for some people, a PVA that's 40 or 50 even, which is going to markedly increase something. So I think when we look at that, that's where I find it hard to use PVA as a tool to actually help educate and to mentor a team member. Because sometimes I might have a team, and I've worked with clinics like this before where I've seen they've had someone who's worked there for 10 years and their PVA looks good because people come back. They might come back even though it's not the best care. It's reasonable. They've come 3 or 4 times and they've had okay results and they keep coming back because you just don't know what you don't know, so they've continued to come back. And so someone's PVA looks good, but when we've dug deeper, they're only seeing someone 3 to 4 times. And that's where we've found the opportunity to help mentor this person and go, all right, along this journey, where can we add more value? So that's why I look at it slightly differently, I guess.
Yeah, makes sense. And I think the point you touched on there is really important, that it's hard to compare a long-standing, 5, 10-year plus practitioner who has a PVA probably of 20 to a new grad whose PVA is going to be skewed because of the number of new patients they're seeing. However, I think about this, and we can touch on the EVA to PVA ratios in a second. The lesson for business owners is that PVA per practitioner isn't useful for comparison between practitioners, but probably is useful for mentoring and progression. And you can compare that practitioner today and in 3 months, 6 months, 12 months time. But you can't compare practitioners. And probably likewise, Mick, for younger graduates, you don't need to compare yourself with the person that's been around forever because context really skews that, right?
Yeah, 100%. And if I just take that to where we see younger practitioners, EVAs, generally almost every team member we've had that started out of uni is around 2 or 3 when they start. Have your experiences been the same? Yeah. And so I think what Peter was alluding to there is that seeing someone 2 or 3 times, you're probably not giving them all the value, education, empowerment, and robustness that modern allied health professionals would want to give to someone. And that's why EVA is extremely important for us to look at for young practitioners.
Yeah, absolutely agree. Okay, so we've established that PVA is the lifetime number of consults the average patient will have, and EVA is the number of consults per episode of care or per injury. And obviously this differs across different therapies. I'm thinking about speech therapy, speech pathology, and OT will have much higher PVAs and probably EVAs compared to an acute care musculoskeletal practitioner or practice. Pete, I'm going to throw to you and talk me through what you would think when you see a practitioner as you look at their numbers who has a good EVA but a poor PVA. What does that mean?
Yeah, so if someone's got a good EVA, and I mean, it's hard to define what's a poor PVA in comparison to EVA.
Sure. Okay, let's talk ratios just as an example, if it's a poor ratio.
Poor ratio. So and I find this very hard to give a definite answer, right? But if someone's got a PVA of EVA, say, of 8 and a PVA of 10, then I'm actually really happy with that person because I feel like we're taking them through that journey. And in my mind, this is very intangible, I feel like, because let's say you work with someone and they don't get injured again for a year or 2 years. It might be a while before they come back. Whereas some people, if they're anything like me, maybe they do dumb stuff, maybe they don't, but they tend to get injured a lot, right? They'll be in more than others. So I definitely find this one hard to answer, but for me, if someone's got a good EVA, then I don't actually care about their PVA so much. And the way I guess we measure PVA at our clinic when we're looking at the total is not so much the total PVA number, but over a quarter, how many people, like how many new issues have you seen? So how many people as a ratio to how many new, I guess, appointments you're seeing per week are return new issues. And so we just track that slightly differently.
Okay. And I think if I can what I'm hearing you say is that if a practitioner has a good EVA, they're seeing patients through their full management plan.
Yeah.
That patient's going to be stoked. They're going to be a raving fan, and word of mouth will happen. And that patient will come back because they were satisfied. So EVA kind of supersedes PVA in your mind.
Yeah, that's the way I see it. And it's completely intangible because maybe they had those 8 visits and they left and they're like, wow, that was shit. So until they do come back, it's hard to say. But that is how I view that one, yeah.
Okay. Mick, what about if the numbers are swapped around? What if that therapist has a poor EVA, and so they're only seeing patients with 2 to 4 consults per episode, but they have a great PVA?
Yeah, I'm really interested to get the data on this. What I'm imagining is if your EVA is 2 or 3, your PVA is probably going to be lower. If your EVA is 17 to 18, I also think your PVA might be lower. I'm imagining there's a sweet spot somewhere between 6 and 10 where you've given really good treatment, you've not over-serviced, you've not under-serviced, client is happy, they're more likely to come back. So I would love to see more and more data on this. I'd be interested to see what the listeners have experienced with that ratio. But to your question, low EVA but great PVA, I guess that tells me that the therapeutic alliance and the interaction is strong. So like, well done. It means you've connected with your patient and they like you and they want to come back. And if something pops up in their life, they know who to call. So that's a really good sign. But as a practitioner and as a business owner, I wouldn't be happy with an EVA around 2 or 3 because I don't believe you can educate, empower and strengthen someone in 2 or 3 visits.
Okay. So you're then bringing that into your mentoring as a business owner. You're using that low EVA to help. How would you guide that mentoring then if you're mentoring that practitioner?
I'd say you're doing a bloody awesome job because your patients are coming back. Right. So it means you must be connecting with them and at least doing some really good goal setting and social history. I would probably mentor that a bit more technically about how much are we strengthening this person beyond their capacity? Are they stronger than before they came? That's how I would mentor it. And I would probably do some treatment mapping. Is like, you saw them 2 or 3 times. Here's what, say, a more experienced clinician would do over 5, 6, 7 or 8 visits. Do you think we could fill the gap between what you've done there and what, say, clinician B did over here?
What about you, Pete?
For the same question?
Yeah.
I don't have too much to, as in how I would mentor someone using
EVA, a low EVA.
Yeah, very similarly. I think, firstly, like Mick said, congratulate them because clearly their patient-therapist alliance is amazing. If we're not giving maybe the best care, but they're coming back because we've got a great relationship there. So acknowledging that to start with, and then really just moving into, all right, well, where are the opportunities for us to add more value? And look at a treatment map and go, in the ideal scenario here, if we took money out of it, if this was an elite athlete, your mum, your dad, your brother, your sister, and they came in with this issue, when are we seeing them day one with a bit of an actual calendar and get them to go, all right, well, day one, I'd see them here and I'd ask them, cool, well, what are we doing day one? What's the outcome of day one? And they might say, well, we want to get them out of pain as fast as possible. And we'll write down all the things we might do day one. And then I'll say, okay, cool. Well, what's next? When do we see them next? And they might mark Wednesday, so 2 days later. And we'll go through again and write down all the things we do in that session. And we'll do this all the way through until we've got them out of pain, we've increased their range of motion, we've strengthened them, functional return to whatever they want, with some education around how not to have that issue again. And a lot of the time, they're really surprised to go, wow, that's 10 visits. Because as Mick said, it's just in 2 to 3 visits, it's just not possible to get amazing results with our clients.
That's awesome, boys. Thank you. I think what I'm taking away there is that EVA is a great opportunity to mentor your team around their clinical skills and their treatment mapping and kind of that zoom in principle. For mine, I personally in our clinic, I actually I like PVA more than EVA from a zoom out perspective.
Yeah.
It allows us to see that entire patient journey. And for mine, it's an average, but it's a great representative of clinical outcomes and client experiences to see people come through their full plan of care and come back and be raving fans. I know we had a clinic within the Business Academy who was looking over the last 12 months or so at tracking both their PVA and EVA, and those who had higher EVA and higher PVA had a lot more word of mouth referrals. So how do you guys see PVA as a reflection of client loyalty and referrals? What's your perspective on that?
I think it's exactly that, Jack. I think the EVA probably speaks a little bit more to technical, clinical, strengthening educational skill.
Yep.
And I think PVA is more loyalty, communication, softer skills, connection.
Right.
I 100% agree with what you said with that. And that's, to me, as a business owner, thinking of the infinite game, that's the one I want. And I think that's why you put such a strong value on that. Yeah.
It does. It's far more reflective over time. And if I had to put a number on it, probably 2 years or more is when PVA starts to become relative or relevant, because it then factors in multiple episodes. Pete, what's your perspective?
Yeah, it's just, for me, I think PVA is good, especially the longer someone's with you, the more relevant it's going to become. I think it's nice for them to be able to see that and see that increases and that people are coming back, they're enjoying the service, there's loyalty. It's a good reflection of that. The thing that I would struggle with from a mentoring point of view is with the EVA, I feel like I can confidently say we want that 8 to 10 visits, and from the average person that's going to be fantastic. Whereas then with PVA, it would change year to year the longer someone's been there, and I would struggle a little bit more personally with what we're actually aiming for. And I think I'd need to look at more data to understand a little bit more, to give them clarity around, because let's say their PVA is 15 and they're like, is that good? And I'm like, I think so. But so for me, it's maybe that I don't know enough yet, and I need to understand it a little bit more from my perspective, and to be able to put it in perspective for them and give them clarity around why it's important, what to aim for, and at different stages in your career, what it should be.
Yeah, it's a good point. I wonder, though, do we compare to normative data and benchmarks, or is it more of an internal comparison for that practitioner? So it doesn't matter what everyone else is doing, it's that you are on the journey of constant, never-ending improvement. So it's internally relevant.
Yeah, absolutely. I think it's...
Okay. Sorry, continue.
I was just going to say, it's always better to compare internally than externally, essentially.
Mm-hmm. Okay, so we're talking a lot about data points here. I want us to speak to clinic owners, and I think by default or by design, we tend towards liking numbers, liking analytics, but almost too much, and end up in analysis paralysis. So tell me, what are the actual calculations behind PVA and EVA? What's the difference, firstly?
PVA, essentially, you're just looking at how many new clients has someone seen, how many is someone seeing that week, how many clients do they have that week, and it's just one divided by the other.
So to be clear, total consults divided by new people.
Yep.
Okay. Yep. And what's EVA?
An EVA is total consults divided by, in brackets, new people plus new issues. So how many essential new issues are coming in, and that a new issue could be a new client, or it could be a returning client with a new issue.
So it would be initial assessments, or assessment consults. Rather than just new people, it's assessment consults that could be a past patient with a new injury. Mick, you agree with that?
Yeah, I'll just jump in. What brought this up for me, if you're a Clinico user, is the report we use. The performance practitioner report actually gave you new people. But when you run, say, the week-to-week revenue report, it gives you the episode breakdown. So depending on what report you're looking at, if it's a report that breaks down initial consult, that will give you the EVA. If it's a report that breaks down new people, that will give you the PVA. Yeah.
And it's a tricky distinction against semantics, but details matter, especially those with the steel lord energy, like myself on the Wealth Dynamics profile. So semantics matter. So, but as healthcare business owners, we cumulatively speak to so many that end up in analysis paralysis and want spreadsheets and data on so many different things. Is this just another thing for business owners to stumble over and get caught on and end up doing nothing about? What's been your experience with business owners that you work with?
I feel it's just about understanding why something is being tracked, because you should only really be tracking things that actually are meaningful to you and your business at that stage in time. And you really need to understand what that number means and how it's calculated. So if you're tracking a number and you're calculating it and you don't actually understand, really what that number means and how you're going to implement that with your team, then I actually think it's quite useless. The way I explain it to my team as we go through and mentor them with these numbers is, these are just numbers. But at the end of the day, a number tells a story about what's happening. And I want to focus on that story. So maybe if you've got a poor PVA, it might be 3 or 4. Let's break it down into what could be involved in that and get them to self-reflect. Because maybe it's their communication. Maybe they're not communicating the plan very well. Maybe they're not creating a plan. Maybe they're projecting their financial beliefs onto someone else. By getting them to self-reflect and find out what part of the story is missing, that's what we focus on. And I don't focus on the number. I focus on what are the opportunities to improve that. And that's how I explained it anyway.
I think it's one of the most, if not the most important thing for a business owner. And I think they need to dedicate a good chunk of their time to it. And then I'm thinking practically how they do that is, you need to have these discussions, particularly with the practitioners who find it a little bit uncomfortable, and even some practitioners who say, I don't want to measure EVA. It's not relevant to me. I want to be a good practitioner. The reality is there's a tension point between evidence-based care, the business, and the practitioner. And if we ignore EVA and PVA like some choose to do, we don't progress as clinicians or business owners or practitioners, because we're avoiding a really important discussion that is around our patients getting best care, that's around evidence-based, and it's around the business. So the first thing I just encourage everyone to do is we need to have that discussion, whether you agree with it or disagree with it. And then the second thing is, speaking to what Pete said, once we have that discussion, we need to get to the story of it. I think too many business owners are like, your EVA is 3, we need it to be 6.
Right.
And they're missing the practicality. So a quick tip is, we go back 6 weeks in the diary, we pull out the new client, and we look at what was done each consult and when the consults were. And we have a mentoring session on that. And in that mentoring session, it includes evidence-based practice, it includes ethics and morals, it includes the business, it includes the practitioner's beliefs and the patient beliefs, and we discuss it. And we also compare to a clinic champion. So someone who had the same type of injury and saw that person 12 times, but I only saw that person 4 times. What are the differences there? That's a really important discussion that you can't, you can't accelerate that. That's a slow but worthwhile conversation to have. And if you can block out even 20 minutes a week to do that for a practitioner, I think it's the most valuable thing you can do.
Yeah, I totally agree. It's making those numbers relevant and relative. I know, I think about some clinic owners who just track so many things that aren't relevant or aren't useful. If that number isn't tangibly, practically useful and changeable within our control, then what is actually the point of measuring it? I know that, clinic owners inside the Business Academy, our Clinic Mastery Business Academy, we don't refer to these numbers as KPIs. They are CEIs, which we call Clinic Excellence Indicators. And I say to my team that to the degree that's possible, we want to measure how clinically excellent you are. There's an element of that that's subjective, that we'll never be able to quantify. But to the degree that we can quantify it, the onus is on us as professionals to continually get better. And so that doesn't mean tracking everything. It means tracking as fewer numbers as possible, but tracking the right numbers. And as you said, Pete, every number has a story and every number should be somewhat within our control. Now, is every number within our control? Absolutely not. But to a degree, every number is in our control, and it's our responsibility as professionals. We have a responsibility to our patients and those in our care to continually get better as practitioners, and as business owners. I think it's our responsibility to get the best out of our team by having sometimes challenging conversations around numbers. So some incredible insights. Gents, if I could ask you for what Pete, go for it.
Just one more thing. You're talking about people that track too many numbers. The way I explain it to some business owners that are tracking every single thing, including just ridiculous stuff, right? It comes down to clutter. It just creates clutter. It's like when you've got 1,000 unread emails and you feel stressed about that, or you've got your desk is completely full of crap, right? It creates clutter, and clutter generally tends to make stress from that. And as business owners, I think we can all agree we don't need more stress in our lives.
Yeah, love it. Gents, what would be your top takeaway from a practitioner perspective?
Good question. Top takeaway from a practitioner perspective for me would be really talk to your business owner. Talk to the person who runs the place, or your mentor, whoever you may go to for these things, and ask them, what are my numbers? Can I see my numbers? And can you explain to me the story behind each number?
Awesome, mate. Mick?
Yeah, I'd be the same. Have the conversation, whether you agree or disagree with EVA as you start out, or maybe your opinions change over time and you liked it at the start, now you don't. I think it leads to so many valuable conversations that they actually form a huge part of our CPD now. It's like, what did you do with that patient? How many times did you see them? What was done each episode or each appointment? I just think you've got to have that conversation to improve as a practitioner.
It's really good. My takeaway for practitioners would be that EVA is probably more clinically relevant, and PVA is your soft skills and client loyalty relevance. That would be it for practitioners. And if I think about clinic owners, what would be the number one pearl for clinic owners to take away? It would be measure as few numbers as possible, but no fewer, and make sure there's a story to every CEI. That would be mine. Pete?
I have nothing to add because you stole everything I was going to say, mate. Absolute stitch up. But yeah, the main thing is really when you're mentoring a team member and you're using numbers, just remember the number is there to track change over time. Look at it once a month with them, but focus on that story. Really focus on what's that one thing we can work on together. Is it the end of the consult? Is it the planning? Is it their communication?
Great.
Yeah, I would encourage everyone to time block that time to go back and look at a new patient from 6 to 8 weeks ago, and it's going to lead to growth for you as a business owner, but growth for your team and your practitioners. And it's not micromanaging, because you're coming from a place of looking after the client or the patient and getting the best outcomes for them.
So good.
Love it.
Folks, if people want to find out more about iMoveU, give us the 30 seconds on the Facebook group and how they can get involved in iMoveU Facebook or events. Mick?
Yeah, come to the group. So go to Facebook, search iMoveU, all one word, capital U, and we live in the group. So join the group. There's a really good conversations going on. Andrew Z's posting some wonderful infographics. I usually get my head on there live and talk about something that made me angry in the week. And we have a course coming up in Sydney, Sunday, the 1st of March. So our one-day course covers everything we've spoken about today: soft skills, communication skills, clinical skills, and the realities of private practice. So good. We send all of our practitioners to that event. Pete?
And we also have our second course of the year, which is on May 3rd, Sunday, May 3rd in Melbourne, if you're Victorian.
So good. And if you're listening to this after May, the events are always in the Facebook group, so be in there. And from my end, for the Grow Your Clinic podcast, you can head over for all the show notes at clinicmastery.com/podcast. And we'll link up to everything that we've mentioned here today. And you can get in touch with us. If you want to learn more about the Clinic Mastery Business Academy, perhaps you're a practitioner and you think your business owner needs to hear about the Clinic Mastery Business Academy, send them over to clinicmastery.com/podcast. And you'll be able to get in touch, assess your clinic on the scorecard, and we'll be able to help you out from there. Super gents, what a time to be alive. Thank you for joining me, and I look forward to bringing you another episode really soon. Bye for now.
Thank you, my friend.
Thank you.
Thanks Thanks for tuning in to the Grow Your Clinic podcast. To find out more about past episodes or how we can help you, head to www.clinicmastery.com/podcast. And please remember to rate and review us on your podcast player of choice. See you on the next episode.